Hello, I'm Dr. James. Today, we're going to have a very important, and I know, very difficult conversation. We're going to talk about the progression of stage 4 pancreatic cancer. I want to approach this topic with the honesty and clarity you deserve. Receiving a stage 4 diagnosis is overwhelming, and the uncertainty of what comes next can be one of the heaviest burdens to carry. My goal today is not to cause fear, but to provide clear, factual information. Knowledge, even when it's difficult, is a form of control. It allows you and your loved ones to understand the path ahead, to make informed decisions, and to focus on what truly matters, your quality of life and your dignity. Let's begin by defining exactly what stage 4, or metastatic, pancreatic cancer is. When a cancer is designated as stage 4, it means that it has spread from its original location in the pancreas to other, more distant parts of the body. The most common sites for pancreatic cancer to metastasize are the liver, the lungs, the lining of the abdomen known as the peritoneum, or distant lymph nodes. It's crucial to understand that at this stage, the primary goal of our medical approach shifts. We are no longer focused on curing the cancer, because that is not a realistic outcome. Instead, our entire focus realigns towards managing the disease. This means slowing its growth, alleviating the symptoms it causes, and above all, preserving your quality of life for as long as possible. This is not about giving up. It is about taking control of your care in a new, strategic, and deeply compassionate way. As the disease progresses, there are common patterns we often see. Understanding these can help you and your family prepare for the changes that may lie ahead. The term we use is increased tumor burden. This simply means that the existing tumors, both in the pancreas and in the metastatic sites like the liver, may grow larger, and new tumors may develop. An enlarging tumor in the pancreas itself can cause specific problems. For example, if it presses on the bile duct, it can cause or worsen jaundice, which is the yellowing of the skin and eyes. If it grows to obstruct the part of the small intestine near the pancreas, it can cause a bowel obstruction, leading to nausea, vomiting, and an inability to eat. Another common development is the buildup of fluid in the abdomen, a condition called ascites. This happens when the cancer spreads to the peritoneum, the lining of the abdominal cavity, causing it to produce excess fluid. This can lead to a feeling of fullness, bloating, abdominal pain, and shortness of breath as the fluid puts pressure on your diaphragm. Alongside these physical changes, nutritional challenges almost always become more pronounced. Maintaining weight and getting adequate nutrition becomes increasingly difficult, which is a significant factor we need to manage proactively. These are the realities of the disease's progression, and acknowledging them allows us to anticipate and plan for them. With the physical progression of the cancer, the symptoms you experience will also evolve. They may change, or they may intensify. This is why a central, non-negotiable part of your care must be proactive palliative care. I want to be very clear, palliative care is not the same as hospice. It is a specialized field of medicine focused entirely on symptom management and can, and should, be started from the moment of diagnosis. Its primary purpose is to maintain your comfort and your quality of life, regardless of what other treatments you are receiving. Pain is often a primary concern. It may increase as tumors grow and press on nerves or other organs. But I need to emphasize this: you do not have to live in uncontrolled pain. We have a wide array of effective tools, from oral medications to nerve blocks and specialized radiation, to manage it. We will work with you continuously to find the right combination to keep you comfortable. Fatigue is another profound symptom, deep bone-wearing exhaustion that rest doesn't seem to touch. We can address this by managing other symptoms, adjusting medications, and exploring strategies to conserve your energy for the things that matter most to you. Nausea and loss of appetite are also incredibly common and distressing. These are not things you just have to put up with. We have medications and nutritional strategies that can help significantly. The goal of symptom management is constant and unwavering, to ensure that you can live each day as fully and comfortably as possible. This brings us to a crucial point in our discussion: the shift in the goals of care. In the medical world, we sometimes talk about moving from curative intent treatment to palliative intent treatment. I know that language can sound stark, but let's break down what it truly means. It does not mean we are stopping treatment. It does not mean we are giving up hope. It means we are refocusing our medical strategy. We are shifting from an attempt to eliminate every last cancer cell goal that is no longer achievable to a new set of goals. These new goals are to control the cancer's growth, to shrink tumors to relieve symptoms, to extend your life, and to maximize your comfort and well-being. This is a profoundly personal and compassionate shift. It is a strategic decision made by you and your medical team together, based on the reality of your situation. It's about ensuring that the benefits of any treatment continue to outweigh the burdens. It's about prioritizing your days, your energy, and your peace of mind. It's about fighting for good days, for moments with family, for comfort, and for dignity. This is not surrender. It is a redefinition of victory. Victory becomes a day with less pain. It becomes sharing a meal with a loved one. It becomes a moment of peace. That is the strategic and compassionate focus we embrace. With this refocused goal, ongoing treatment remains a cornerstone of care for many patients with stage 4 pancreatic cancer. The idea that a stage 4 diagnosis means an immediate stop to all medical therapy is a common misconception. Often, treatment continues for as long as it is helping. Chemotherapy, for instance, may be used in lower, more manageable doses to keep the cancer in check and to shrink tumors that are causing pain or blockages. In some cases, targeted therapies or immunotherapies may be an option, depending on the specific genetic markers of your tumor. Radiation therapy can also play a vital palliative role, directed specifically at a painful tumor site to provide relief. The key here is that your treatment plan is not static. It is dynamic and will be adjusted frequently. We will constantly assess how you are feeling, how your body is tolerating the treatment, and whether the cancer is responding. We will perform scans and blood tests, but just as importantly, we will talk to you. How is your energy? How is your pain? What side effects are you experiencing? Based on these conversations, we might adjust a dose, switch to a different medication, or decide to take a treatment holiday to give your body a rest. Your experience, your voice, is the most critical piece of data we have in guiding these decisions. The goal is always to use treatment as a tool to serve you and your quality of life, not the other way around. Finally, let's talk about preparing and supporting yourself through this journey. Thinking about the future is difficult, but it is also an act of love for yourself and for your family. This is the time to engage in what we call advanced care planning. This involves making clear decisions about the kind of medical care you want and do not want in the future. It means appointing a healthcare proxy, someone you trust to make decisions for you if you are unable to, and completing documents like a living will. These are not easy conversations, but they are a gift to your loved ones, sparing them from having to make wrenching decisions in a moment of crisis. It is also the time to understand the role of hospice care. Hospice is not a place you go to die. It is a philosophy of care and a comprehensive support system that focuses on comfort and quality of life when treatments are no longer effective or desired. Hospice brings a team of nurses, aides, social workers, and spiritual counselors to you, most often in your own home, to provide an extra layer of support for both you and your family. It is about living the final chapter of your life with dignity, peace, and as little distress as possible. And through all of this, please, do not underestimate the power of your support network. Lean on your family and friends. Allow them to help. This is also where your emotional and spiritual well-being becomes paramount. Find what brings you comfort, whether it's through faith, meditation, nature, or simply spending quiet time with those you love. And remember, you are not alone. Communities like the Pancreatic Cancer Warriors exist for this very reason, to connect you with others who truly understand what you are going through. They offer a unique kind of support that can be a lifeline. This journey is not easy. There is no way to sugarcoat that. But you have the strength to face it, and you have a team, your doctors, your nurses, your family, your community standing with you. We will walk this path with you, every step of the way, focusing on you as a person, not just a patient, and ensuring your care is guided by compassion, respect, and a commitment to your dignity. Thank you for listening.